Ladies and gentlemen, welcome to Interview with Experts Season 7, proudly presented to you by the Malaysian Dental Students Association, MDSA. I'm Juan, a representative from the Academic and Research Bureau of MDSA. For today's episode, we're very honoured to have with us Dr. Kuok Yew Jhin. Dr. Kuok graduated with first-class honours from Penang International Dental College. He then obtained his membership in Faculty of Dental Surgery and Periodontology from the Royal College of Surgeons of Edinburgh. He then completed his specialist training in periodontology at UCL London 2020. Currently, Dr. Kuok is in a private practice limited to periodontics and dental implants at Artius Dental Specialist Centre, Kuala Lumpur, which is where I'm at right now. So let's head over to meet Dr. Kuok. So good afternoon, Dr. Kuok. It's a pleasure to meet you and have you here with us. So Doctor, how are you?
I'm very well, thank you.
Okay. On behalf of MDSA, we would like to first thank you for accepting our invitation to be part of our very special guest today. So without further ado, let's begin with the interview. So Dr. Kuok, you're a periodontist. What made you choose periodontics as your career path?
So firstly, again, thank you, Juan, for this kind introduction, and to MDSA for inviting me to be part of this endeavor. So coming back to your first question, what made me choose periodontics as my career path? So I'd like to believe that most specialists or all specialists at some point started off as maybe being selected to be attached to a specialist or even to be hand selected by a specialist or to be guided by one or inspired by one. And I'm no different. So I was inspired by a periodontist actually, and it all started as when I was a dental student actually in my third year. So my mom was a patient of Dr. Jeanette, and simply because of that, she invited me to come every time I had term breaks. And I hated every moment of it, to be honest, because as you know how precious our semester breaks are in dental school, where compared to our non-dental friends or non-medical friends, they get 3 months off summer holidays and we get 1-2 weeks if we're lucky, right? So I would have to then spend the whole week observing, and I didn't like it, not because I wasn't interested. I didn't like it because I didn't know what was going on. I didn't understand. I saw procedures that I never heard of, or even looking back at the textbooks, they're either a really small chapter with no photos, and so I felt like this wasn't dentistry. But that ticked a little bit, because that told me that what I learned in 5 years is definitely not enough. So I knew my learning had to continue after this. So that planted the seed of me wanting to specialize to begin with. Now, but on a more serious note, when I started my career as a young dental officer in my first year, I was actually very obsessed with oral surgery. In fact, I almost wanted to do oral surgery, from doing on-call emergency cases, ward rounds. Even once I had no sleep, minimal food and water for 48 hours straight, stinky, smelly, tired, grumpy, but somehow I had a sense of fulfillment. Or maybe that's just my kind of obsessive nature. But to cut the story short, I was offered a job with Dr. Jeanette again, and I immediately said yes. And I saw things from a very different perspective, from a very perio-based perspective, and life got easier actually, because as I started in private practice, I realized not what I really liked, but what I didn't like. So I wasn't good at root canal treatments, naturally. I didn't really like fillings. I don't believe I was good at handling children. So rather of a process of elimination, I found perio, and that's the story of it.
Okay. So during your journey, I'm pretty sure you faced a lot of challenges. So can you brief us on what challenges you faced and how did you overcome them?
Okay, so I suppose the main one was coming back amidst a pandemic and MCO, right? So I came back at the end of 2020, and once I came out from my quarantine, it was MCO again, right? So And this posed the difficulty of me establishing a presence as a young periodontist in Kuala Lumpur. Typically, I would be going out with my friends on weekends, and that's how we kind of establish connection and referrals. And obviously, that was out of the that was not an option for me. So how did I overcome that? I was also fortunate. So the beginning of the pandemic was towards the end of my my program, and while I was quite free at that lockdown, I started this online kind of teaching under my alumni. So I think within that 2-3 months, we organized I think about 27 lectures. It was only open to my alumni group, so myself included. I've got some of my friends to just kind of maybe share and teach and stuff. So maybe that's one way. And since coming back as well, I mean, we're still in the midst of the pandemic. I've given online lectures back at my university in PIDC. I have in fact given a lecture to the MDSA UK as well. 3 years in a row actually. 2 years was physical, and then the third year was online. So maybe that may have helped overcome a bit of my sort of the establishing a presence. The second thing I would say is that what I get a lot of patients telling me is that I look very young, right? And I can't escape that. I can't change my appearance, right? So, but I would say how I overcome this issue, still trying to figure out the right formula, is that I adapt what I've learned from the UK, which is the UK style is very much based on communication. And I think that's something that maybe I didn't learn very much in while I was in undergraduate, but this is very important, how to listen, how to get to the point, how to instill confidence in your patients, which I think maybe as Asians we're not natural born orators, and compared to maybe somebody from the UK. So I think that's how I overcame this young look.
Right.
And the third one that I found challenging is that there's I think the awareness of periodontal disease among both dentists and the public in Malaysia is quite low. We tend to always blame maybe the patient's awareness for not understanding perio, but I feel personally slightly different. I feel that all dentists, we as dentists, we are all ambassadors of our profession to promote oral health, gum health, and so I think it starts from us. So one example I think we can overcome this is that, so following from the UK for example, all the general dentists are required to do something called a BPE or basic periodontal examination, and this will take, I don't know, 2-3 minutes to perform, not a full kind of periodontal charting. And this serves as a guide to refer patients, right? It's not an assessment of the severity of the disease, but it's just to help you guide what should you do. Are you able to manage, or do you need to refer? So it's just that kind of simple tool to use. Now this is significant because in the UK, the litigation cases, more than 50% of it, or just over 50%, means the majority of the cases are from patients suing their dentist for not detecting gum disease. So that is quite a shock to me. And one of my earliest patients that I got referred to when I was in London was not from a dentist, but from a hygienist who referred a very straightforward, moderate periodontitis case. And to me, it was something different because I think the awareness there is so much better. So that's why I think some of the challenges that I face, and I think one way to overcome this is for us to really promote periodontal health, and one simple way you can do it is through the BPE.
So in your biography, it is stated that you've completed your specialist training in the UK. So many students out there, like me, myself, are very interested to pursue my studies in UK. So can you share with us your experience on how your postgraduate years have been like in the UK?
It is the best time of my life, but it's also the worst time of my life. So let's start off with the best. I mean, I deliberately chose London for various reasons, but one of it was because London to me is a truly multicultural city. It's like Malaysia with an expansion pack. So I have had Ethiopian food from eating Ethiopian food all the way to being in a small little Spanish bar where everybody is Spanish and everybody is speaking Spanish and I spoke Spanish to me. And so these are the kind of experiences that it's truly worth, I think, just going there to expose yourself to all this. Now, within the program itself, I was lucky to have been able to travel at least 3 times a year to different countries to go for perio conferences, symposiums of the best quality, and the exposure itself is just fantastic. So, for example, I've been to places from Amsterdam to Valencia to Sevilla to all the way to Gothenburg, where perio is the birthplace of perio. And this is actually the strength, I believe, in pursuing a postgraduate overseas, is because we don't use textbooks anymore. We use articles, journals, and it's written by some name. And it's really cool to then be able to put a face to the name that we're studying. And you can actually see them face to face, just a normal human being, right? As we read them, it's like they are gods in our whole academia. But then you see them, they're just like you and me. And the best thing is that I then have dinner with them, sit down, and after dinner is clubbing or drinks. And yes, they do like to go clubbing and drinks. But despite all this, the bad side now, the program was really, really tough. It was really, you're alone, you're in a foreign country, you will have to plow through, and it is really different from the challenges that you will face as an undergraduate. It is more lonely, I would say. And unfortunately, my personal experience was that something happened internally within the department towards the end of second year, and that really affected my batchmates and myself, which I almost at one point wanted to give up. So that's how serious it is. Towards the end, despite my parents spending so much money, I got to that point, dark point. But on balance, I have no regrets. If I can do it again, I will do it again in a heartbeat. Of course, I've changed a few things. Because I made lifelong friends. I traveled the beautiful country. From camping to pub crawling and even visiting Europe. So that's the highs and lows of my experience.
Okay. You mentioned that at that point you wanted to give up. What made you decide to not give up?
Oh, fantastic question. So, I think it's because when I made the decision to pursue a postgraduate, I did it for myself. I did it it's a challenge. I didn't do it for fame or money or parents asked me to do it or I did it because I wanted to do it. And this is really important because whoever is going to pursue postgraduate, you will come to your lowest point. And what really pulls you through is you yourself, your grit, wanting to just carry on. And to me, that's what got me through.
That sounded like a very tough journey, and it's amazing how you're able to pull it through. So now, coming to the topic of digital dentistry. So digital dentistry is the future of dentistry. Do you agree with this statement, and why?
Very much so, and I'll go as far as to say that this is the next big leap in dentistry, I believe. So I think in the last 50 years of dentistry, the major leap is probably the way we did research. We've had journals, and in fact, the concept, the idea of systematic reviews, where we can then collate all these case studies, do it in a systematic manner to come up with a higher kind of evidence-based approach. And I think that was the major leap. But the next one now is, in my opinion, is digital dentistry. It is basically incorporating technology into our lives, and technology is generally a good thing. It's like in the Marvel movies, it's like Tony Stark giving Spider-Man an upgrade, right? So the costume doesn't make Spider-Man Spider-Man. Spider-Man is still Spider-Man, but with the upgrade, he becomes a better Spider-Man, right? So I think that's what digital dentistry is like. And is it really going to be the future? Again, I say yes, because it has not only permeated into implant dentistry. You'll be surprised, orthodontics, and not just Invisalign. I think conventional orthodontics as well is trying to incorporate digital dentistry. Endodontics, nobody would think about it. Oral surgery as well. So it is there, whether you like it or not. So yes, it is definitely the future.
Okay. So, Doctor, I came across this article that talks of fabrication of implant reconstruction. Can you briefly explain to the audience on what fabrication of implant reconstruction means?
So I guess reconstruction means to build back what has been lost. And in this term, we want to build back what is lost to restore function, aesthetics. And implant reconstruction would probably be achieving that using dental implants. Yeah.
So in your opinion, why is the use of digital technologies for fabrication of implant reconstruction said to be more effective than the conventional technique?
More effective is a little bit questionable. But so if I were to be really pedantic, I can say how accurate is digital dentistry. So you have examples from even the intraoral scanning. It may be up to about 15 microns off. And when we 3D print stuff, it may be up to 30 microns off. Is this 15 and 30 microns significant? We don't know. And then when we are planning for something, we typically need to superimpose the clinical scan and maybe a CBCT together, and then you have human error, how you superimpose and you combine them. And then also it depends on how accurate the CBCT was taken, what kind of brand of scanners that you use. All these things considered. There are many ways where we can make small little margins of errors. Will it be significant? Some camps may argue yes, but I would also say that although it seems to be in the beginning of digital dentistry in Malaysia, we are fortunate that other countries like in Europe and in the States, they have started this many years ago, 15-20 years ago, and they have troubleshooted all the small problems to what it is today. I would say that it is a fair statement for me to say that it is fairly more effective and more accurate. So yes, definitely more effective overall.
Oh, okay.
Yeah.
So digital dentistry is on the rise. So how should dental students get more exposure to digital dentistry since it has yet to be implemented in dental schools?
That is certainly a problem. I definitely wasn't exposed to when I was in undergraduate, but maybe that was some time ago. And I would even say minimal exposure when I was in London. Unfortunately, I think this is going to be a problem probably in the next 10 years. But I would also say this, the top universities in the US and in Europe, they are starting to adopt this into their undergraduate program. So to me, that is fantastic. I think it has to come sooner rather than later. How should dental students get more exposure? I think that is a very, very tough question. I mean, within the Malaysian dental students or dentists in Malaysia, within the context of Malaysia, I think you just have to grab whatever that is available. So I do see a trend of lectures now shifting towards digital, which is really, really good. But these are non-university based. I mean, they're slowly shifting out. That means maybe the MDA or that they're starting to incorporate these independent kind of academic companies, right? Second thing is that one of the good things that came out from this pandemic is that all these online lectures are free, just all over the internet. And when I mean you grab whatever that you can grab is this. So just Google or go to YouTube or follow all these pages. They've become more prominent over the last 2 years because of the pandemic. So grab whatever that you can and just learn it. It's only the beginning.
Yeah. Okay. So to all the dental students out there who wishes or choose to pursue digital dentistry, are there any advice that you would give them?
First thing is that I think it shouldn't be an option. I think everybody must pursue it. But it's not to say that this is something that you need to forget your basics. Get your basics right, but to supplement it, right? So you have to be the Spider-Man first, and then pursue this. And I tell you why this is not an option, because you are going to come out and practice for the next 30, 40 good years. And if you don't start, you're going to lose out in 10 years. You're going to fall behind. And even if you may think that, oh, I have a dental clinic in a small town taking over my uncle's clinic or something like that, it will catch up with you. Because if I put things into perspective, 30, 40 years, people are getting smarter, people are going to Google more, and you will inevitably fall behind. So advice is that, so I have a few advice. First thing is that keep an open mind and know that whatever that you learn in 5 years is not enough. Just like that's like how I felt many years ago. I think it's similar. Learning never ends, and I don't use this word lightly. Never ends. I'm still learning. I didn't learn much of digital, and I still am learning every day and going for all these kind of conferences and events whenever I can. But if you have that attitude, that never-ending quest to understand things, I think you will be all right. Some practical tips. Again, look out for courses online. And another piece of advice I would like to say is, just like all lectures, take it with a pinch of salt. So I'm contradicting myself a little bit, but before you start flying in digital dentistry, you need to understand your basics very well. Now, what do I mean by take it with a pinch of salt? I probably get killed for saying this, but there are many false prophets, what I like to say, around. And just because they delved into it earlier and they've played around with some fancy equipment, but there is a lot of learning, a lot of science that people kind of forget. So I won't call this misinformation, but probably disinformation. And these are actually good. It's very natural, because when people try to push the boundaries, that is how we actually move forward. So it's all part and parcel of how we progress in 10 years' time. You have to make mistakes to know that it's a mistake, right? And I suppose the last piece of advice is that the saying is, don't work hard, work smart. I think that is insufficient. I think you have to work hard, smart, with a direction and guided, right? So if you just work very hard alone, you will go around in circles, and And if you work smart alone, you will start doing shortcuts. And trust me, in dentistry, the shortcuts will come back to haunt you. And if you have a direction, it is also risky. If you follow one of these false prophets, you may lead down a road where it is a little bit off the cliff. And the last one, again, with a mentor, you need to find the right mentor as well, and to get good guidance. But if you put all these four together, work very hard, smart as well, with a direction and a good mentor, I think that is probably the most complete way of engaging into what I believe is the next leap of dentistry.
I see. Thank you so much for the advice.
Thank you.
Okay, so now here comes the most exciting part of the interview, the rapid fire round.
Okay.
So I'll be asking you 10 questions, and Doctor, you'd have to answer them as quickly as possible. So are you ready?
Yes.
Okay, let's go. So, describe yourself in 5 words.
In 5 words. Uh, OCD, fun, um, lazy, adventurous, and a bit geeky.
Okay. If you could win an Olympic medal for any sport, what would it be?
It would probably be table tennis, because I like table tennis.
Your favorite book?
My favorite book, Harry Potter.
What is success?
What is success? I think it has to be defined by an individual.
If
Yeah.
you could live anywhere in the world, where would it be?
Somewhere in Switzerland.
Coffee or tea?
Coffee.
Favorite TV show?
Game of Thrones.
How do you handle stress?
I go out with my friends and have a drink.
Your hidden talent?
My hidden talent. I would like to think I can cook.
What are the qualities of a good dentist?
Honesty, safety, and never ending learning.
Okay, so we have now come to the end of this interview. Dr. Kuok, thank you so much for being so sporting in answering all these questions.
Thank you.
I'm pretty sure the dental students out there who are watching this have gained a lot from this interview.
Thank you very much.
Thank you so much.
Thank you. Thank
So
you.
see you all in the next episode of Interview with Experts Season 7. Goodbye.
Bye.
Okay.